Hi, I'm Mel Pickup, Chief Executive of Bradford Teaching Hospitals, and welcome to this month's roundup of stories from across the Trust. It has been a month like no other, with the very, very sad news of the death of Her late Majesty Queen Elizabeth. The Queen dedicated her life to public service, and it was our proudest moment when she awarded NHS staff the George Cross earlier this year for their compassion and courage over the last 74 years, but particularly during the pandemic. On behalf of our Trust, we offer our heartfelt condolences to the royal family. I would also like to extend my thanks to all our NHS staff who worked over the bank holiday, ensuring that our services continued to run for patients. Shortly before the period of national mourning, we were able to take a focused look at our place, meeting the team and patients at the newly opened Shared Care Hemodialysis Unit at St Luke's Hospital. Here's consultant John Stoves, renal clinical lead, to tell us more about the unit and share some patient stories.
For a long time, we've had an aspiration to develop a shared care hemodialysis unit here at St Luke's, and with COVID and other factors, there's been a considerable challenge in delivering this project. But with the support of the whole team and our sponsors, we've been able to manage to deliver the construction of the unit in this time frame.
I've only just had this fistula made and operated on, and it takes time to establish, but the journey will be that I have home treatment.
I started the training for dialysis April this year, and I think we were fully sort of independent around about June, July.
The key driver for this project has been to allow our patients to achieve independence where they wish and be able to go home and have their treatment at home if they so wish, otherwise to be active participants in their care here at St Luke's Hospital.
Thank you, John, and a special thanks to Sovereign Healthcare and the Friends of St Luke's, whose contribution helped to make that new unit possible. Now, I'm excited to share today the first episode of our new podcast series. This is where I sit down with a colleague and partners from across the Trust to hear about their contributions to the health and well-being of people across the district. For the first episode, I met with Elaine Appleby, the new independent chair of the Bradford District and Craven Health and Care Partnership. In this clip, Elaine tells us more about her career as a social worker and how her early experiences showed her the power of partnership working.
I moved to work on Homewood Estate, and there, two social workers, me and a senior social worker, were asked to go onto the estate and support parents because there was a lot of distressed families at that time on Homewood where children were coming into care, or some of them even, ending up on the abuse register. And so we went onto the estate, and the senior social worker said to me, he said, we are going to listen to people. We are going to find out what they think would help them be even better parents, and we're going to support them put those ideas into practice. And that was such a powerful and different approach. And it still is today. I think they call it now asset-based community development. But in those days, we just took that as an approach.
You can hear the full episode of my chat with Elaine by subscribing to the podcast. It's available in all the major podcast providers. Simply search Let's Talk with Mel Pickup. Well, that's it for this month's update. We look forward to sharing more stories with you next month, including our next podcast, spotlighting Breast Cancer Awareness Month. Don't forget, all our latest news and updates can be found on our social media channels, Twitter, LinkedIn and Facebook.